Hi guys, welcome back to the new episode on my YouTube channel. I hope you all are doing great. Today we'll talk about all the lysosomal storage diseases. So let's begin our discussion. The first lysosomal disease we'll talk about today is Gaucher's disease. It is caused due to the deficiency of beta-glucocerebrosidase. In Gaucher's disease, there is an accumulation of glucocerebrosidase. The key clinical features include hepatosplenomegaly, bone involvement and crumpled tissue paper appearance of macrophages in the bone marrow. Let's move ahead and talk about the next lysosomal storage disease, which is Niemann-Pick disease. It is caused due to the deficiency of sphingomyelinase. In this, sphingomyelin is accumulated and the key clinical features include hepatosplenomegaly, foam cells in the liver and spleen, and neurological symptoms. Now let's move ahead and talk about our next lysosomal storage disease, which is Tay-Sachs disease, which is caused due to the deficiency of hexosaminidase A enzyme. GM2 ganglioside is the accumulated substance in this disease, and when we talk about key clinical features, we observe cherry red spot on macula, developmental delay and neurodegeneration. Now let's move ahead and talk about our next lysosomal storage disease, which is Fabry disease. It is caused due to the deficiency of alpha-galactosidase A. There is an accumulation of globotriaosylceramide GB3. The key clinical features include burning pain in the extremities, angiokeratomas, renal and cardiac involvement. Moving ahead, let's talk about our next lysosomal storage disease, which is mucopolysaccharidosis, MPS. In MPS, there is an involvement of various enzymes. In this, we observe an accumulation of glycosaminoglycans. The key clinical features include coarse facial features, skeletal abnormalities, hepatosplenomegaly, and developmental delay. Now next, let's talk about Heler syndrome, MPS1. It is caused due to the deficiency of alpha-L-iduronidase. There is an accumulation of heparin sulfate and dermatan sulfate. Heler syndrome is a severe MPS phenotype with developmental delay, coarse facial features and hepatosplenomegaly and corneal clouding. Continuing and moving ahead, now let's talk about Hunter syndrome MPS2, which is caused due to the deficiency of iduronate 2-sulfatase. There is an accumulation of heparin sulfate and dermatan sulfate. It's a mild MPS phenotype. The patients have aggressive behavior and no corneal clouding. Now we'll talk about Sanfilippo syndrome MPS3, which is caused due to the deficiency of heparin N sulfatase, acetyl-CoA, alpha-glucosaminidase, acetyl-CoA alpha-glucosaminide, acetyltransferase and N-acetyltransferase. There is an accumulation of heparin sulfate. Now let's talk about the key clinical features, which include progressive neurodegeneration, mild somatic features and no hepatosplenomegaly. Now let's move ahead and talk about Moro syndrome MPS4, which is caused due to the deficiency of galactosamine 6-sulfatase and beta-galactosidase. There is an accumulation of keratin sulfate. The key clinical features include short stature, skeletal abnormalities and corneal clouding. Next, we'll discuss about Krabbe disease, which is caused due to the deficiency of galactocerebrosidase. Here we find an accumulation of galactocerebrosidase and psychosine. The key clinical features include peripheral neuropathy, developmental delay and optic atrophy. Next we'll talk about metachromatic leukodystrophy (MLD), which is caused due to the deficiency of aryl sulfatase A. Here we find an accumulation of sulfatides. When we talk about its key clinical features, it include central and peripheral demyelination, ataxia and dementia. Now we'll talk about our next lysosomal storage disease, which is Pompe's disease, which is caused due to the deficiency of acid alpha glucosidase GAA. The accumulated substance is glycogen. Now let's talk about the key clinical features, which include cardiomegaly, hypotonia and respiratory distress in infant, progressive muscle weakness in older children and adults. The next disease in the list is cystinosis, which is caused due to the deficiency of cystinosin. There is an accumulation of cystine. The key clinical features include renal Fanconi syndrome, corneal crystals and progressive renal failure. Let's move ahead and talk about glycogen storage diseases. There is an involvement of various enzymes and the substance accumulated here is glycogen. The key clinical features include hepatomegaly, hepatoglycemia and muscle weakness. So let's end our today's video with the discussion of Fabry's disease. It is caused due to the deficiency of acid ceramidase. It has an accumulation of ceramide. The key clinical features include joint deformities, subcutaneous nodules and neurologic involvement. So that's all for today. Thanks for watching. I hope you liked this video. So please don't forget to subscribe to my channel for more such videos. See you in my next episode. Till then, bye. Take care.